Counseling from the heart, helping women eliminate tobacco use and exposure.
We know, and most women know, that smoking and tobacco use is harmful across one's lifespan, and especially during the reproductive years. Most women are concerned about the effects of smoking on their children's health, particularly when they are pregnant or have young children. This concern gives you the opportunity to counsel women who smoke when they have an additional motivation to quit.
This video teaches healthcare providers how to effectively counsel women to quit smoking and eliminate their exposure to secondhand smoke.
Patients expect their physicians and healthcare providers to ask them about smoking. Your personal support to facilitate smoking cessation is critical. In this video, you will learn how to assess your patient's readiness to change, determine the most relevant information for your patient, help her create a quit plan, identify strategies for dealing with difficult situations, and provide quit smoking resources.
Remember, stopping smoking is a process. Effective counseling happens anytime you help a woman think about quitting, aid in her decision to quit, help her quit, or help her to stay quit. This video complements a guide for counseling women who smoke. Both use the 5 A's counseling techniques. The 5 A's are a clinically proven, best practice approach for smoking cessation counseling and are a quick way to organize a counseling session. In this video, you will see counselors ask, advise, assess, assist, and arrange follow-up as they help women to stop smoking. Ask.
Ask about tobacco use status at every visit. Document tobacco use status.
Advise.
Provide clear, strong advice to quit. Discuss health benefits of quitting.
Assess.
Determine willingness to quit smoking or using tobacco. If not yet willing, provide motivational intervention.
Assist.
Encourage STAR, S-T-A-R. Set a quit date and develop a quit plan. Tell family and friends. Anticipate challenges. Remove tobacco products from the environment. Provide support and help patient obtain social support. Discuss triggers and coping skills. Provide educational and self-help materials. Discuss pharmacotherapy. Refer to North Carolina Tobacco Use Quit Line for support between visits.
Arrange.
Follow up at next visit or by telephone. Contact shortly after quit date, 1 week. Congratulate success. Identify problems, answer questions. Repeat advise for women who continue to smoke.
This video uses the Stages of Change model to help you provide immediate, individualized smoking cessation counseling as you interact with your patient. This model enables you to tailor your conversation as you assess a woman's readiness to quit or to remain smoke-free if she's already quit. The 6 stages of readiness for change are pre-contemplation.
Not considering quitting. May not be interested in hearing about it.
Contemplation.
Beginning to think smoking is a problem for her and is likely to respond to information.
Preparation.
Interested in quitting. Has taken some steps to quit.
Action.
Actively quitting and following her quit plan. Needs help to stay quit during the first few weeks.
Maintenance.
Has quit smoking.
Relapse.
Has started smoking again.
Using the 5 A's techniques and the Stages of Change model allows you to
personalize the quitting smoking process. Enhance motivation to quit. Guide your patient with relevant skills and information. Tailor your messages to the patient's stage. Promote appropriate follow-up and provide information and referral based on needs.
Using these techniques also show that you care about your patient. are listening to her and look to her as the expert in her life.
Observe the counselor's techniques and how they learn where the patient is with smoking and her readiness to change or maintain life as a non-smoker. First, let's compare Kathy's counseling using the 5 A's with Sarah's that does not use the 5 A's. Step 1. Ask. Determine if the patient smokes or uses other tobacco products. If she does not use tobacco, praise her and reinforce the importance of her decision not to smoke or use tobacco. Find out if she was a smoker or used tobacco, and if so, congratulate her on quitting. Reinforce the importance of staying quit. This is an opportunity to ask if she has cravings and to offer assistance. Ask about her exposure to secondhand smoke. The same 5 A's can be applied here. If the patient smokes, move on to the second A, advise.
Linda, I see that you indicated that you smoke cigarettes. Are you still smoking?
Yeah.
Well, what have you heard about the effects of smoking during pregnancy?
Well, some people say don't do it.
People say don't do it because it harms the baby. And I do recommend that you stop smoking. Now, I know quitting can be hard, but it's the most important thing you can do for the health of your baby and for you.
I'm doing all right.
Have you ever thought about quitting?
No, not really.
Assess includes exploring the patient's smoking habits, her family's smoking patterns, her past attempts to quit, and identifying the stage of tobacco use that describes her. Let's see how Kathy continues to assess her patient using reflective listening.
Okay, well, tell me a little bit about your smoking, Linda.
Well, I get up in the morning, make my coffee, and smoke a cigarette. My husband smokes, and most of my friends smoke. My sister smoked when she was pregnant. I don't really plan on quitting just because I'm pregnant.
It sounds like you smoke regularly and that most of the people around you are smokers. So you're not ready to quit.
Yeah, well, we smoke. We smoke in the house and in the car. We go out and everyone smokes. It's no big deal.
Have you or has anyone you know tried to quit smoking?
Yeah, well, some of my friends. But it would be such a hassle if I tried to quit now, and if I tried to get everyone not to smoke around me, I'm not even going to try.
So it sounds like you don't see any point in quitting since your husband smokes and your friends smoke. But did you know that most people won't smoke around you if you ask them not to?
Well, I hadn't thought about that.
Linda, can you think of any reasons why quitting would be a good idea?
For my baby?
Okay, well, tell me more about that.
Well, I've heard that smoking can cause health problems, and this is our first child. I'd like her to be healthy. I've heard that smoking can make babies get more colds and stuff.
Well, that's true, and these are good reasons to quit. But smoking during pregnancy and after the baby comes can cause more serious problems too. So, it seems that you think there are reasons why quitting would be a good idea. For example, for the health of your baby. Is that right?
Yeah.
Okay, so where does that leave you now?
Well, I'd like to think about all this stuff and talk to my husband and maybe look it up on the internet.
There are some good websites, and I'll give you some addresses. Well, Linda, I appreciate you talking with me about smoking. It's not always easy to talk about. I hear you saying that you're not ready to quit right now, but I really recommend that you do stop smoking. At your next visit, let me know how talking with your husband goes. And Linda, if you or he have any questions before then, you can call me, okay? And you can call the North Carolina Quit line at this number.
Okay.
Kathy listened carefully and asked questions that opened up the dialogue between her and her patient.
She asked about smoking and advised her patient to stop, assessed the patient's smoking habits and thoughts about quitting, assisted her in exploring reasons to quit smoking, and arranged a follow-up plan.